Hi there, my name is Vic Veer. I'm the head of the ENT Sleep Surgery Department at the Royal National ENT Hospital in central London. And today I'm going to tell you about the iNAP device. This is a follow-on video from my last video, and I'll leave a link to it or a smart card or something around about here. Just basically, the iNAP device is a device that helps people with snoring and sleep apnea problems. The way it works is that it sucks air out of your mouth, which seems counterintuitive because CPAP blows air in. How would this work if it's pulling air out? And what it's actually doing is there's a little straw in your mouth, a bit like this, and this straw goes into your mouth and sucks air out of your mouth. And the idea is that it pulls the tongue and the palate forward so it doesn't snore, the palate doesn't flap around, it gets stuck to the back of the tongue, and the tongue rolls forward. So when you're lying on your back and your tongue falls back and blocks your breathing, it will stop that from happening so you can breathe behind your tongue, behind your palate, without it causing flutter or blockage. So this video will be all about what has happened since that first video was released until now, and also what the future holds for iNAP in this country. So one announcement I have, since that last video came out, the distributors of the iNAP device have come up to me and offered me a job, which is very nice. They've said to me, could you be on our medical advisory panel, which I'll be very happy to do. But the trouble is I have to be slightly more careful about what I say, because I don't want to say, oh, this is brilliant and please buy it, because it sounds like I'm trying to sell the device. And luckily that's not my job. My job is to try and help you use this device, because it does take a little bit of getting used to, and I'll try and give you some tips today about that in this video. So as I said, I need to be slightly careful about how I say things now, because I don't want to come across as trying to sell this product. I want to try and remain as authentic and as genuine as possible on this YouTube channel. So when I'm talking about the iNAP device from now on, I'll just be talking about the evidence. And the way I think I've got around it is that I've asked the distributors to give me a whole bunch of iNAP devices and loads of these mouthpieces. And what I'm doing is I'm trying them out on my NHS patients at the Royal National ENT Hospital. So the plan is that I'm bringing people in, I'm giving them the iNAP device, and then I'm going to do a drug-induced sleep endoscopy on them. In case, I guess, subscribers to my channel will know what a drug-induced sleep endoscopy is, because they're all experts now. But so just in case you don't know, a drug-induced sleep endoscopy is where I'm trying to work out where in your throat the obstruction and problem is with your snoring and sleep apnea. There's no point me looking at your nose and your throat right now, because you're awake and you're not snoring and you're not stopping breathing. It doesn't make any sense to see someone who's awake. So what I do is I get people to lie down, give them a touch of sedation so they start falling asleep in front of me, and then when they're asleep I put a telescope in the back of their nose, try and avoid waking them up, and watch what's going on at the back of their throat, see where the flutter is coming from, see where the blockage is coming from. And then I wake them up and I show them the video and say, look, this is what we found inside your throat, inside your nose. These are the reasons why you have this problem. These are your individual reasons, because everyone's slightly different. And then I give them a plan, what devices would work, what devices wouldn't work, what operations would work, and which ones wouldn't work. And then I can say, look, these are the success rates, failure rates, risks and complications, things like that. Now what I'm trying to do is also use this iNAP device at the same time, and then I can turn it off in the middle of the drug-induced sleep endoscopy, so I can see what happens to the back of the throat. And I can see, look, actually this seems to work in you, or this doesn't seem to work in you. Now that I've been doing that on a few patients so far, not many, and what I'll do is at the end of this video I'll give you those results. The main thing I learned from this NHS trial, however, is that it's really difficult to get used to using this device. It's very difficult to get it in the right place, very difficult to use it and get the right seal, all those sorts of things. So what I've done is I've just created about 3 steps that I want to talk to you about in this video to get you, helping you use this iNAP device properly, because it does take time, it does take practice, and I thought it'd be very easy, just put it in their mouth, turn on the machine, and then off we go. But actually it takes a really long time, and I didn't appreciate this. The distributors say, look, it sometimes takes about 30 days, and they have a 30-day plan to help you through that. This is not as complex as that, but what I'm going to do is give you a few of the tips that I've learned when trying to get people to use it within 5 minutes, which is very difficult, and I've realized it's very difficult. But I will show you hopefully some of the videos at the end of this video of people who've managed to use it, just managed to use it within 5 minutes, and see the results in their drug-induced sleep endoscopy, so you can see the inside of their throat and how the difference is with or without the iNAP. Okay, so step 1, the first thing you really need to know is that you need to be able to breathe through your nose to use the iNAP at all. If you remember, this thing is going into your mouth. It completely seals off your mouth. There is no way to breathe through your mouth, so you have to be very comfortable breathing through your nose. And a lot of people actually don't realize that they can't breathe through their nose. They spend such a long time breathing through their mouth and waking up with a dry mouth in the morning that they don't realize that their nose is blocked because they don't actually use it. They've forgotten what normal is. And suddenly having this thing put in their mouth, they realize, oh my God, I can't breathe. I feel claustrophobic. I feel like I'm suffocating. If you're feeling that, you really ought to go and see a doctor, because you might have a really blocked up nose and you can't use this, or to be honest, you can't use CPAP or a mandibular advanced device or any sort of mouth device when you have a blocked nose. So that's one of the first things you need to sort out when you have snoring and sleep apnea. Unblock your nose, to see your doctor. But the first thing we say, if you think you can breathe through your nose, is to try using this iNAP device whilst watching TV, just sitting there watching TV with this thing stuck in your mouth. And so if you can watch a movie without pulling this thing out, then clearly you can breathe through your nose and it's not affecting you too much, as long as you feel comfortable. If you feel red in the face, you feel like you're really struggling like this, then obviously there's something going on. So some of the things that your doctor might say would be, look, try some hypertonic Sterimar, which is basically very salty seawater, just to clean out your nose and try and open it up a little bit. Next step would probably be something like nasal steroids or other things that they can see in your nose. If your nose is twisted, you might need to be referred to an ENT surgeon. And there are other things you can do at home. If you can do this and go, oh, I can breathe better when I do that sort of maneuver or this sort of thing. If you feel like you can breathe better with that, you might have a problem with a blocked nose. So, as I said, do see your doctor, because there's no point really using this if your nose is blocked. It's better to unblock your nose first, see if that sorts out your snoring and sleep apnea and other problems like that, and then consider the iNAP. The second point is all about the seal, and what I mean by the seal is that it ends up falling out of your mouth, and there are several reasons why that might happen. Now, one of the first is you might find when you're practicing using the iNAP device, you're going around the house, doing your household chores just to see if you can move your head without it falling out. You might notice it keeps falling out and you go, what's going on? Why is it doing that? And it might be because of the Mouthpiece seal. Now, this is the original Mouthpiece, and we've said to the manufacturers, actually, everyone's slightly different. Some people have bigger mouths, smaller mouths, and maybe this tube is too long for some people, too short for some people. So what we've done is, in this country, is try and create a starter pack. So you'll have a range of different sizes and different types of mouthpieces. Sometimes the cheek bit here is a bit bigger, and again, I'll show another video on the side here about that. Or maybe this tube is a bit too long. I've also noticed that some people can get the end of this tube here stuck at the back of their tongue or something like that. And if that happens, the whole thing blocks off and it looks like you've got a good seal, but really you don't. You just blocked off the end. So what we've also done is brought out a new type of mouthpiece, which spreads out this single hole here, so it doesn't keep getting blocked up. So there's lots of little ports of entry into the suction device, so it doesn't keep getting blocked up. So all these different mouthpieces will be available, but the starter pack will have a few. You pick out the one that you think works best for you and say, look, actually, I want it slightly bigger or slightly smaller. And then they'll send you off the correct one so that you can use that long term. And so the other advantage of this new mouthpiece is that it's slightly firmer, it doesn't fall out quite as much, and also you can change the angle of where it sits inside your mouth. And I'll show you again a close-up here for that. Now, if you remember, there are two ports of entry into the mouth, through the front and through the back. So point 3 is about air coming from the back of your throat, from behind your tongue into the mouth, and that breaks the seal there as well. So we need to be able to create a seal on the back and also the front, so that you can create that vacuum inside your mouth. And I found in the trial that I've been doing on the NHS patients, this is one of the biggest problems, that people put in their mouth and says, can't feel anything, can't feel any suction at all. And just because the back of the throat is open, and therefore you're sort of breathing into it, and therefore it's trying to suck all the air out of your lungs, which it's never going to be able to do. It's not that strong. So you need to seal the back of the mouth off from the throat, and that way that you can start getting negative pressure, so the tongue rolls forward and the palate rolls forward. So if we're in this situation where you've got this thing in your mouth, you turned on the machine, it's not working, or you feel like it's not working, the blue light's flashing, why is it not sucking anything out? It may be because of the seal. What you need to do is try a little trick. So one thing that we've learned is that if you go like this, that humming noise seems to block off the back of the throat slightly, and suddenly it latches on and the vacuum starts being created. Another thing you can do is you can try and swallow whilst this mouthpiece is in your mouth. What this does is it can block off the back of the mouth, allowing the airway to open. So then you create that negative pressure, which slowly draws that tongue forward. I've also found just practicing snoring like this or like this with this thing in your mouth does help sort of create that seal, and you can also notice that it sort of sticks to your palate sticks to the back of the tongue, and therefore it stops snoring at that point, so you know you're almost there. It's really important once you've got the seal right at the front, right at the back, that you get a deep enough negative pressure inside your mouth so that it can roll your tongue forward. If it's strong enough, you find it very difficult to prevent your tongue from rolling forward out of the way of the back of your throat. And eventually also, slightly harder actually I've noticed with snoring, that the palate flops back and gets stuck to the back of the tongue. And the way I test for that is to go like this and go, oh right, it's not doing anything right now. But when it's in the right position, you find it very hard to... You'd sort of do this and you find it very hard to snore with this thing in. You'll see that in my other video. I'll try and leave another link up there if you want, which shows me trying desperately to snore, but I just can't. Once you're in that situation where, oh, I can't snore with this iNAP in, and you can try tugging at the cord like this, and if it feels stuck and it can't come out very easily, well, then it sounds like you've got the right amount of negative pressure and it's in the right place and you can't snore. I think you're set, ready to go. Now, there is an app that comes with the iNAP device, and that will tell you how much negative pressure there is and how well you did that night. So do try and download that, and once I've had a good look around it, I'll try and do another video about that app as well and give you maybe some more tips about how to use this iNAP device. So the main thing I've learned from this trial I'm doing on my NHS patients is that it's quite hard for people to get used to using this thing and getting it in the right position. I thought it'd just stick it in the mouth and it'd be fine. It seemed to work for me. But it's actually quite hard for some people, and it takes time, it takes effort. I think the distributors say that it's something like learning how to drive a car. Once you got used to it, it's very easy. But at the start, you're like, oh God, I'm struggling. I don't know how to work this thing. It's a bit like when you've got a CPAP mask and you don't know which mask size or which type of mask you want to use. And it takes time to get the settings right, or the mandibular advancement device, how to clean it, and all this stuff, the positioning and getting the right amount of advancement. All of these things are important when you're trying to use a new device, and it does take time. So it's really important that you get the right mouthpiece, you get the right position, the right seal at the front. You have to make sure the back of the mouth is closed off so you can breathe down your airway. You have to make sure you've got enough negative pressure. There's all these things you have to consider. And once you've got all that right, you'll start noticing benefits, hopefully at that point. So on saying that, I did manage to get a few patients on the NHS to be able to use the iNAP device within the first 5 minutes of me giving it to them. So the first patient I got to be able to use this properly is a gentleman with quite severe obstructive sleep apnea. I'll try and show a video of him right here. And you can see at the start, he's able to breathe. Although you can see a little bit of snoring, he is able to breathe and it seems open. As soon as you turn off the iNAP, suddenly everything collapses down and he goes into an apnea, he can't breathe. So this would be a really good alternative for this gentleman to get him off his CPAP, because he really couldn't tolerate it anyway. So this would be a way around that. And hopefully with a bit of practice, he'll be able to try and stop the snoring in this gentleman. So there is another patient I got who had very mild obstructive sleep apnea, or basically upper airway resistance syndrome, but he also had very, very loud snoring, and his snoring did seem a lot better with the iNAP device in place. And when I turn it off, he starts snoring. I keep pointing here, hoping that I've got the video for him, but I'll better check that later. I have had people this week, for example, a lady who used the iNAP device, felt it was very comfortable, felt that she had the right amount of pressure in her mouth, but when we started the drug-induced sleep endoscopy, it didn't seem to be doing anything for her off and on. It didn't make any difference. So I'm not sure why it was different for her compared to the other two people. So what I need to do is try and carry on this trial, find out why some people do well with this, why some people don't do well with this, and try and pick out what I can do to improve things for these people. So I'm going to keep going with this NHS trial. I've got another idea as well with the distributors to say, look, because some people just can't use it within the first 5 minutes, can you send some of my patients who are due to have a drug-induced sleep endoscopy with me on the NHS in the next, 2 or 3 months or whatever? They can trial out the iNAP device in those 2 months, try and get used to it, try and get the right amount of suction, so when they turn up, they're real experts at using the iNAP device, and then see if I can get better views on their drug-induced sleep endoscopy. And then hopefully I can see, oh look, with practice, these people do better. It may be completely opposite. Maybe actually some people just can't use it at all. Some people can. That's why I'm doing the research, and that's why hopefully we'll have more answers as it goes along. Now, rather excitingly, the distributors say that they can launch the iNAP device on the 1st of December. I know I've given out other announcements when it was in November, but unfortunately some of the team have had COVID and they've had to stall the launch date. but currently the launch date is the 1st of December. They're starting with this starter pack, and if you remember, there's 12 possible mouthpieces you can use. They'll only give a few, but you just need to pick the right one, and then they'll send you over the right mouthpiece for the one that you've picked up for your mouth. And as I said, this is a new device. We don't know everything about it yet. If you found that you've got an issue which isn't covered by this video or some of the starter pack information that you get, do let us know either through my newsletter, which you can see in the description of this video, or call the My Snore Clinic website, which is the distributor of the iNAP device. And if we can collate all those problems and issues and worries that you have about the iNAP device, then we can try and fix things for you. And I'll try and give some information in these videos or write to people, and maybe that will help people along the way. So in the future, what I'll do is I'll send out more videos about how to use this device as the problems and issues come through, and I can try and answer those issues for you. I'll also give you the results of the trial that I'm doing on the NHS. And if you are one of my patients who's waiting for a drug-induced sleep endoscopy and you'd like to be included in this iNAP trial, I can try and send one out to you before your drug-induced sleep endoscopy so we can see how an expert does during their sleep endoscopy. Thank you all once again for watching this video. I'll see you in the next one. Bye-bye.